It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi again, everyone. Jim Knox along with Great Cells. Welcome back to another edition of the Best Docs Network, featuring some of the best doctors in the entire Dallas-Fort Worth area that help change people's lives.
That's right, Jim. And up first on our show today, we're going to hear from facial plastic surgeon Dr. Jadro Ducik.
So before I met Dr. Ducik, I just felt like my skin was dull and spotty and splotchy, and was constantly trying to search for makeups that would make a difference transitioning into my 50s.
Skincare is obviously very, very important. The skin is what everybody sees. They don't see the underlying bone. If we do somebody's rhinoplasty, they're not looking at their cartilages, they're not looking at their jaws, their cheekbones, their eye sockets. They see the skin. That's the first thing that you see. So ideally, you want the skin to look as good as possible.
Typically, Dr. Ducik does like me to see patients before they have surgery. He'll do a consultation and he'll send me in the room and say, please talk to them about skincare. Let's get their skin looking good first, and then we'll, discuss surgery.
I always feel at home with Jennifer. She is a very well-versed in skincare, and she pays attention to my age, and we stay really focused on what it is that I'm trying to accomplish.
Well, the whole point of doing cosmetic surgery on somebody is to make them look better and feel better about the way they look, and more comfortable in their own skin, so to speak. And so one of the first things we always try to do is tune up the skin, make the skin look as good as possible, because then people oftentimes are so happy with their skin that they don't feel like they need to sometimes even do surgery.
As you get older, your body you lose the collagen in your skin. Collagen's kind of like the springs in a mattress. You start to lose volume, and you'll start to notice fine lines and wrinkles. By stimulating the collagen, your skin will become firmer and the wrinkles will start to dissipate. There's several different things that we offer that help stimulate collagen, one of them being the Dermapen. It creates micro injuries to the skin, and when the skin starts to heal, it starts to rebuild collagen, which is pretty amazing.
And the goal is not to do surgery, the goal is just to make somebody look better.
I no longer have to search for makeups that cover up. I just feel younger than I thought I was going to feel in my 50s, and just feel brighter, and that my skin finally is at a place where it's glowing.
BestDocsNetwork.com helps you find the right doctor for your medical needs. Watch videos on each doctor and decide for yourself who fits you best. On the Best Docs Network homepage, you can see the latest videos, search for a doctor, find educational content, and watch the latest TV episodes from each BDN market.
My specialty of prosthodontics really is the plastic surgery of dentistry. And in order to have a successful outcome, we want our patients to look beautiful and refreshed like the plastic surgeons do, but we don't want anyone to focus on why that is. And my specialty of prosthodontics exists because we make people's smiles as perfect as possible. We make people's smiles perfect with veneers, crowns, or implants. Each patient has a tailor-made treatment plan that we execute to give them the smile they've always wanted. It's very profound, the effect that teeth have on a person's facial structures. Part of the aging process is that people lose teeth or they lose bone, and that changes their facial shape, and it makes them age prematurely. So healthy, beautiful teeth support the face, and that is a part of what we try to do. For our patients who are missing teeth, we certainly want to give them back a beautiful smile, but part of the process is giving back the fullness and the youthful appearance from having the soft tissues restored as well as the teeth. During our diagnostic phase, we try to identify the problems with each patient's smile. Some people's teeth are too long, some are too short, some are too narrow, some are too wide. So there's a variety of ways that we can fix virtually every smile. And part of the specialty of prosthodontics is to know the modalities that need to be employed to fix each patient's smile and make it a custom, beautiful smile. My approach to these treatments is that I want to partner with my patients to create a breathtaking, functional smile. And the end result is life-changing for them, but what I love is it's life-changing for me too. To see their reaction and to participate in that, it's life-changing for me as well. I think most of our patients who go through a smile transformation have greatly improved self-esteem, and that's one of the most satisfying parts.
Did you know that blueberries can help improve your memory? Consuming blueberries helps to improve your memory by protecting your brain from inflammation and boosting communication between your brain cells. On our website, bestdocsnetwork.com, we have a map that can help you find the best doctor that's closest to you. That could be our next doctor. It's plastic surgeon, Dr. Robert Wilcox.
Gynecomastia is a very important part of our practice that I enjoy doing. Gyneco means woman-like, and mastia means breast or chest, so it's a woman-like breast. On a man, that means not just necessarily obesity, but also the glandular tissue that comes along with it, which is the hard, fibrous area that you can actually feel under the nipple and the areola. We see many young men who get it with the onset of puberty, and then we see many men in their 20s, 30s, and 40s who have no antecedent cause for this. Gynecomastia surgery traditionally has not been a very satisfying operation for either the surgeon or the patient, and the reason why is 99% of surgeons are still doing the same technique that's been done for the last 80 years. They put the patient to sleep, they make a 3 o'clock to 9 o'clock incision around the areola, they start cutting out the tissue under direct vision, then it starts bleeding, they can't see very well, they may get a contour problem or a depression, and then ultimately they put drainage tubes in from the side to drain out the fluid.